Hello, everybody. This is Duncan Turner, and you're listening to episode 3 of the Vagina Doctor podcast. Today, we're talking to triple board certified plastic surgeon, Dr. Allison Pontius, and discussing her unique journey from plastic surgeon to the Pontius Technique and Anti-aging. Please enjoy this. But what do I know? I'm just a vagina doctor. Welcome, Allison. Thank you very much for joining us today. Dr. Allison Pontius, a triple board certified plastic surgeon who also works in our office, has joined us in the office in Santa Barbara in September, and has been a tremendous addition to our ability to look after patients. Allison is really remarkable. Just describing really the qualifications that she has. We call it triple board certified, and what that means is that she has been board certified in ear, nose, and throat medicine, and then beyond that did a fellowship in facial plastic surgery. And as though that wasn't enough training, she is qualified also in A4M, which is the American Association of Anti-aging Medicine, and is specializing in longevity, and particularly with reference to the plastic surgery that she's done. So welcome, Allison. Thank you very much for coming today.
Thank you. It's a pleasure to be here.
So tell me about this long ordeal of medical school. And so most of us have been through long periods of time of doing that, but you've done the extra miles.
Yeah, I really enjoyed education. So after medical school, I knew I wanted to be a plastic surgeon. Initially, I thought general plastic surgery. So I went to the Mayo Clinic for general surgery, which is what we do prior to our specialization, as you know. I did a year of general surgery, and then I transitioned to otolaryngology or ENT because I wanted to specialize in the face, and training on the anatomy and doing surgery on the head and neck was a little bit of a better preparation for facial plastic surgery. And that's the typical route all doctors do for facial plastic surgery. So I made that change. I moved to University of Texas Southwestern Medical School in Dallas and did otolaryngology, and then followed that with facial plastic surgery in upstate New York for a year. And then I was in practice after that. The anti-aging studies came a few years later, really just out of a passion. I'm super interested in anti-aging, super interested in longevity and health in addition to aesthetics. So I did that sort of, over a 2-year course where we traveled once a month. At that point, nothing was online. So we were going all over the country, right, taking different courses on different aspects of, really health for the most part, but also new kind of anti-aging strategies.
And so when you first went into practice doing the facial plastic surgery, were you doing surgical procedures as well as injectables?
Yeah, definitely. Mostly surgical procedures because we have to collect this series of 100 cases to get our boards. So I literally did 100 facelifts to get my boards. And did the injectables on the side, of course. The Botox and filler were, they'd been around, but they were still kind of in their infancy as far as technique and results and all of that. So it was always kind of an adjunct to the surgery initially.
But you really had planned that from the beginning of moving into the injectables as opposed to doing the surgery?
Well, not really. I had every intent in the beginning of continuing doing surgery. I just, between life events and kind of taking a long view of my career, gradually sort of made this decision that I not only intellectually, I found this growing field of injectables super interesting, and started spending more of my time doing that. And then just, I like to sleep at night, and the stress of surgery, and especially, honestly, cosmetic surgery is super stressful. It's not life and death, but it kind of feels that way. And I had a new baby, and, my husband's a surgeon. Putting all that together, I just made a life choice to focus on the one thing I liked the best and kind of let the other things, go to a degree.
And did you feel that doing the injectables was actually giving you a better result than surgery might have? And certainly much less downtime.
Totally. Less downtime. I could do something in the office that was super gratifying to me, and I could give a really beautiful result to a patient. And it's more of a long-term relationship. The surgeries, at one point where I was working, I'd sort of meet them. We'd operate and I'd see them a few follow-ups, and that was kind of it. So it's this long-term relationship. You're changing their face by millimeters. It's not, a drastic lift. So you are working on all these different aspects of aging and working with them over time. And safety-wise too, it's just, not that there's no risk with it. There certainly is, and we can talk about those. But I just felt like that was just the path for me, really.
Well, I've seen results of your surgery, and it's really impressive. It's so subtle. Patients don't look like they've had anything done.
Exactly.
And they get the result that they want. And I'm sure it's less stressful for you than doing the surgery, but it's still stressful. I mean, you've still got a patient to satisfy, and plastic surgery patients are very particular.
They are particular. And we always say it's surgery of millimeters. And so things have to be really precise. What I didn't know when I was younger, as a young surgeon, is how much that relationship with the patient matters and the trust that they have in you. And I kind of, once you let go of trying to be completely perfect and, stay up all night because it wasn't quite right, once I could kind of get over that and just build this relationship with the patient, I want them to look their best. And I'm going to help them get there in every way that I can with my skills. It just developed this whole new level of patient care and just a great relationship with the patient where I just felt they were putting their trust in me and I was going to do everything I could to help them. But at the same time, being very honest and upfront about what fillers can and can't do as well.
Now, you've developed your own technique of doing this called the Pontius Technique. Can you tell me a little more about that?
Yeah, it's something I had been doing, and we just sort of, branded it more or less. And it's a full face rejuvenation. So we're starting in the temples. We're involving the mid face, lower lids, the jawline, the chin, really every aspect of the face, putting little amounts of filler to create a really balanced, proportional look. So I measure people's faces. We rely on the golden ratio, which is sort of the ancient Greeks developed this way of measuring beauty in both faces and nature. And so there are these ratios, these mathematics of the face that if we apply, it really guides, it just tells me exactly where I need to go. And then I use some artistry and, creativity to make sure everyone sort of has a unique look. But we're really, beauty is really math. And so I'm relying a lot on, some more precise measurements as well as sort of an artistic look. So it's really a full face rejuvenation, which differs for every patient because everyone's a little bit unique.
And it doesn't all have to be done at one time.
Correct. Yeah. Anything it can be done at once, but often we'll do it over the course of 2 sessions, most commonly, sometimes 3, depending on what our goals are. And we're really trying to, address the 3 aspects of aging: wrinkling skin, sagging skin, and then just the quality of the skin itself.
And how long does this last for patients?
Most of the fillers I use are FDA approved for this kind of structural shaping work for up to 2 years. So I usually tell them, 18 months is what I usually see clinically, even though technically they are approved for longer periods. And I usually will have them come back at 1 year because we always need a little touch up. They don't have to go through the whole thing again, but we do want to make sure we're keeping up with the aging process.
Okay. I didn't mention earlier that my partner Karen Spaulding is also here on a mic to give us her wisdom and her questions. I want to go back to the reason or the way that we got in touch with each other, and I think it's a kind of cool story. I like it, and correct me if I'm wrong with any of these facts, or maybe Karen, you could describe what happened.
And I'll correct you if you're wrong.
No doubt about that.
Yeah, we got an email from you.
Yep.
And I remember we were traveling or driving. We were in the car.
Mm-hmm.
And yeah, I just was really excited and
Well, I think
looking forward to meeting you. And
yeah,
because you had this expertise that we were wanting in the office.
Yeah. So I had been in practice in New York for 18 years, and I had been dying to come back to Santa Barbara. And I was just doing my research, and I was looking at the different practices in town, and I saw your website, and it was so gorgeously done. And it just looked like a really interesting practice, not just doing, what we always do is sort of plastic surgery and the aesthetics, but to have the aesthetic gynecology and different aspects of health and care for, primarily women. And so, yeah, I just totally cold called you and reached out, and the rest is history.
Yeah, I love that. And I felt like we all got along right away and had similar vision of what we wanted. And one thing we are known for, the office, Turner Medical Arts, is always having this expert level of care. So it was really important to us who was going to come and be that person for injectables.
Because there is nobody in Santa Barbara like you that has the qualifications that you have, has the experience that you have. And these were areas in our practice where we felt there were, we needed some help. And now that's how a vagina doctor comes back to an ENT doctor.
I know.
And
what a combination.
So, yeah. But we're dealing with a lot of the same patients, with the same patients' needs, who want to be really healthy, want to live long, interesting, active lives, and in all senses of the word. And I think that you've really helped fill that gap for us. I want to talk a little bit about the seriousness of what you do, in that it's not just about patient satisfaction, it's also about patient safety. And a lot of people do injections. It seems to be almost a spin-off for a lot of physicians who can look at a way of making an easy few more bucks by having people in their office that are injecting with Botox and doing some fillers as well. And the Botox isn't particularly dangerous. It's a good safety ratio, but fillers are different. And we unfortunately have experience in this group talking now because Karen had some fillers injected a few years ago and experienced one of the significant complications. It was a nasolabial fold injection with a filler that became intravascular. Wasn't recognized right away. It was done by an experienced nurse injector, not a physician, but we needed a physician to bail her out of this. So would you talk a little bit about some of the dangers that you face? the patients face.
Absolutely. And it's such a good point to bring up because I think there's this conception that fillers and non-surgical treatments are easy. You run in your lunch break and do it. It's no big deal. And to some degree, that's true. But yeah, the most feared complication of fillers is a intravascular occlusion. And it's just when the needle injects the filler into a blood vessel, often an artery, and blocks the flow of the artery. So all the skin that artery feeds is now devoid of any nutrients and oxygen. And so the skin literally dies over it. And it's a huge area. You know, it's not just this little spot where you've injected. Those arteries, and they also feed the eye too. So blindness is a risk as well.
Which is permanent. It could be.
It can be permanent. Yeah, unless you have to move fast. I think there's 90 minutes before it's permanent. So, and it's scary. Thank God, knock on wood. The blindness is quite rare. It's often seen in countries that do a lot of nasal injections, like in Asia, Korea, injections around the eye area, a little riskier places, honestly. So, what happens, and it, like you said, it can happen to any injector. It's not just someone who's inexperienced and that type of thing. So we always have to be cautious. We always have to have a plan of how to treat it. But the underlying thing is prevention. You need to know your anatomy as best you can. And I think doing so much facial surgery has been a huge advantage for that because I've seen it. I'm not just looking at a book, which a lot of, nurses and injectors, that's the only choice they have sometimes. So, however, there are more cadaver courses now that people can do. And there's a bigger focus on safety. But in the beginning, it was a little bit of the Wild West where we were all injecting initially nasolabial folds, which is probably one of the more dangerous places to inject. And it can be quite scary. So for patients, go to an experienced injector. There's great nurse injectors. There's great PA injectors. But I would go to the highest level of experience you can because, it's a real risk.
Well, it is, and also reaction to, you're talking about 90 minutes. That's not very much time to realize it's a significant problem. And you've got to have the equipment available, medications available to resolve that issue or to help resolve it.
Yeah. And that's a good question for patients to ask, like, what's their protocol if something does go wrong, or what happens? What do you do? And if they can't show you a piece of paper with a protocol written on it or tell you, number 1, number 2, number 3, I would look elsewhere because that has to be something that's like always in our mind. You need a lot of product to dissolve that filler with on hand at all times, and sometimes even ultrasound to localize it. Mm-hmm. And there are, set protocols for how we can best manage it. Certainly any eye complications, we want to get involvement of a ophthalmologist for sure, because they inject, retrobulbar, which is an injection basically, around the eye, which not all of us have ever done. So it's just, I don't want to scare people away because it is still quite rare, but you have to be prepared. You have to always have it on your mind, and you have to have a real plan for if it happens.
Right. In Karen's case, there wasn't any blindness involved, but there was significant necrosis of the skin on the face.
Yeah, it was really scary. And
we didn't know how bad it was going to get because the injector didn't realize the complication at that time. It was actually the next day that we made that diagnosis.
Yeah, because you were out of town, so I was by myself.
Yeah.
And I think I went to 2 plastic surgeons in Santa Barbara. One of them really, I think, helped save what was gonna happen. And then I went down to UCLA and was there for weeks. I mean, not staying there, but back and forth.
Yeah.
But treatment in a hyperbaric oxygen chamber was involved also. I mean, this is no small matter, and I think I bring up this point because injections are not thought of, as you said, of being particularly risky, but they are, and you need to go to somebody with. I mean, my thought is, why would anybody go to anybody but you? It's just.
Well, yeah. I mean, the key too, and with Karen too, had they recognized it, you may not have had that degree of skin necrosis and
Right.
drawn out, because you can reverse it immediately if you recognize it. The patient's going to have increased pain. You're going to see a flash of white. There are definitely signs. So it's not like patients should worry when they go home, like, is this going to happen to me? It really should be something happened during that injection that should have been noteworthy. And a lot of referrals that I had gotten of people that weren't recognized immediately, and then I treated them after the fact, similar to you, they all would kind of tell the same story.
And just for the listener right now, describe what necrosis is, because a lot of people don't understand that word.
Yeah, so it's where the skin actually, from a lack of blood flow, it dies. So it goes through stages. So the first stage, it kind of looks like a bruise. It has a purple mottled look to it. And then as the days progress, it starts to what we call demarcate, where you see the boundaries of the abnormal skin, the purplish skin, to normal skin. And then that purple skin, as that blood flow has not been reperfused, it turns a dark color, a blackish color, and almost just starts to scab over.
That's what happened to me. And it was like from the left-hand side of my nose all the way up the left-hand side of my face and the corner of my eye, up my forehead and into my scalp.
Gosh. Yeah. So that's the angular
I'll
artery.
supply a picture.
I was going to say, we've got a picture.
We will show a picture. And my daughter was in grade school, and I was extremely active at the school, like at the school every day doing things. And I couldn't wear a mask back then because nobody was wearing them. But yeah, it was really traumatic. And I remember being really embarrassed and not wanting to talk about what happened.
Yeah.
So I think I even said I had shingles or something like that.
You lied?
I think I lied.
They're like, I've never seen shingles like that before.
I know, but people just, I mean.
Especially it was a few years back, and it wasn't as
like
well known.
10 years ago,
yeah.
I think.
Yeah.
About 10 years ago. Yeah. But it was frightening. It was just
it's
really
scary.
terrifying.
It's scary.
And I think a lot of it for me was that it was an elective procedure that I chose to do. And then, oh my God, am I going to lose my eye? What's going to happen?
Because then you blame yourself for being vain.
Yes.
That why, this wasn't worth it.
Yeah.
So, but yeah, to put in perspective again, it is really super uncommon, even given the number of injections being done. So thankfully, we have that, but everyone has to be trained in that. And my academy has this trust your face to a facial plastic surgeon motto. And I'm not saying you have to go to a facial plastic surgeon, but just really vet who's doing your injections and what their protocol is if there was a complication like that.
Yeah.
The one of the questions that I asked you, or we asked you before coming on this, was you're the person who does what? And I think from talking to you and from your answer that you gave us at the time is to be the best you can possibly be at it. And I think that's clear. And that's why that was the motivation of continuing the path that you continued. Some of the areas that you and I share is the use of hormonal treatments. And although I use it generally for hormone replacement therapy, postmenopausal patients, but we were talking the other day about the differences that you see in patients' skin before and after menopause, and before and after hormone replacement therapy. Can you go into that a little bit?
Yeah, definitely. It's almost this classic presentation to me where women come in, they're probably 51, 52, 53, and they say, I've aged overnight. And whenever they say that, did you just go through menopause? Yes. It's just without a doubt that there's an acceleration of aging around that time from the lack of hormones and hormonal balance. And just a fun fact, you do lose 30% of your collagen in the first 5 years after menopause. And that's a lot. So
Yeah.
it really, the lack of collagen, the lack of hydration in the skin, the thinning of the skin, the wrinkling of the skin is so accelerated from the loss of estrogen that even patients that I hadn't seen in a year or two, they look like they've aged so much during that time. So I'm a huge proponent of estrogen for women, for the health benefits, of course, for symptoms, of course, but also if they feel like they're having this rapid aging and they're really down about that, it really is helpful when they're using estrogen as well.
Yeah, absolutely. Estrogen was basically in the 50s and 60s, it was thought of as the fountain of youth. And then it sort of dropped out of popularity for a number of reasons. Perhaps those associated with the Women's Health Initiative study in 2002, but which gave estrogen a bad name, unreasonably gave it a bad name. But it really is that. It does slow the aging process. It strengthens the body. It strengthens the bones. It strengthens the cardiovascular system. And so it's really interesting to talk to you and see that how visually this can make a difference to people.
Yeah. And when I see patients that come in new to me that have been on hormone replacement that are in their 60s or beyond, they look fantastic. And
Yeah.
there's a quality to the skin that looks different. The skin is thicker, which is actually something we want. We want it more robust. We want it thicker. And, I think they feel better too, and that certainly helps. So it's such a disservice that estrogen got such a bad reputation from the WHI study. And, if you really break that down, and I think finally now doctors are starting to really talk about it and what the faults in the study were, what the different medications that are not the same as the medications most people prescribe now, and kind of bringing estrogen back is fantastic. And I hope the dialogue continues. So
Great. I think that this is what I've seen since you've been associated with us is just the numbers of patients that work that we can both help, and so when we looked at it theoretically, you and your husband joining us in the practice, it's been even better than we imagined for our patients.
yeah. And that's even when we were, before we even met, just the thought of that sort of trifecta of affecting women's health and then how they look at the same location. And we have these same patients in common. We can talk about, we can, determine care plans for them in these different aspects. I think it's just great for women. It's just so nice to have a place that they can go and be themselves and talk about the issues affecting them, and we can use all our skills to improve their lives.
Great. So thanks for joining us.
Of course.
Oh, wait, I have one more thing
Yes.
to interject. The two of you are going to be doing a segment every month, and it is going to be called Anti-aging Deconstructed. And I just want to talk about that briefly. We're going to be having experts in the field of anti-aging on to talk to both of you. And I think a lot of people have questions. A lot of people are so confused about all the different things you can do for anti-aging. And I think it's going to be great to start informing not just our patients, but other people as well in their options and different things they can do.
Things have changed a lot. And I mean, this is a huge growth industry now, and everybody's wanting to live longer, stronger, better, and taking care of themselves. And it's so having people that were really up to date or trying new techniques, more experienced than us, will be really valuable for our patients and for all of you listeners out there.
Yeah, I'm super excited about that. I've got a million questions, and and I just want to, even from when I trained in anti-aging, 15 years ago now almost, it's really come a long way, and it's not this fringe, field that was sort of outside of normal medical care. It's really a key component of medical care, because really what's going to kill us is heart disease, dementia, diabetes, or cancer. And that's like step one of anti-aging. Mm-hmm. So it's really just good medicine. And then we take it to the next level with these other therapies that can just enhance the quality of your life and promote longevity. And I just find it fascinating. So I'm really looking forward to that.
Okay, so Dr. Pontius, I have a question for you. In the pre-podcast forum I sent you, I asked you the question if life experience taught you to push boundaries and reach higher, or if it was something that you were born with. And I want to know your answer to that question.
Well, definitely not something I was born with, I don't think. Maybe to a degree, but it is interesting. And growing up, I never once felt like as a girl or that I somewhat wasn't entitled to the career and the life that I wanted. I never felt I had to follow any particular path. So maybe that was sort of an intrinsic thing. And then once I got into college, medical school, and kind of realized my intellect and the power that I had, I really just, one of my mentors said, I'm like those fighter jets that when they lock into their target and just start following them,
oh, wow,
they just go after it. So whatever I wanted to do, I felt like I could get that if I just worked hard enough and went after it. And that's what I tried to do.
Was that reinforced in your family growing up, though? Or do you think at just a certain point in your life, you became aware of that superpower?
I really think once I was, out of high school into my, college, and I was outdoing, most of the guys in my class, and I could do well and excel. My father was also a physician, and I think I admired him and wanted to follow to some degree in those footsteps too. So I think that got me towards the medical path. But I just realized I had the capability to do it, and I didn't know that when I was younger. So I think once I realized it, it opened up a lot of doors.
Yeah, I have to imagine it would. But it's also, just pointing out that as a woman, I think it is difficult to have that wherewithal, especially at that age. So there must have been something else. There must have been some component that maybe you always had, but you didn't really.
Yeah. I think, honestly, I don't think I had any challenges in my younger life that made me kind of aware that I needed, to push through some boundaries. And then once I went to college and was on my own, and I just knew what I wanted to do. I wanted to, go to medical school. I wanted to get the best grades possible. I wanted to be on a Division I athletic team. And so I just kind of willed it into existence.
What athletic team?
I was on the track team and the cross country team for UC Santa Barbara.
Oh, wow.
So
That's great. What was your event?
I was a long distance runner. So I did the 1,500 meters, 3,000 meters, and cross country, which is always a 5K.
Well, that kind of, I guess it sort of explains your focus, because to run those types of races, you have to have focus.
And
like that.
endurance.
Yes, and endurance.
But it's, there's ups and downs through life. There's times you doubt yourself, and there's times you buckle down and you believe in yourself. So I don't want to make it sound like it was a perfect upward trajectory, but I never felt held back from what I wanted to do. I knew I could do it, and I found a way to do it.
You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. See you in the next episode. The Vagina Doctor Podcast. It all starts here.